Hi, my name is Nicholas Cohen, and I'm the director of the AmeriCorps Super Coach program, which is a coaching program to provide tobacco cessation coaches to practices across university hospitals. Objectives. List 3 reasons to refer smokers to the AmeriCorps Super Coach program. Identify best practices for how to refer patients to a super coach. Describe suggested prescribing guidelines for nicotine replacement therapy, NRT. Be familiar with documentation and billing for tobacco cessation counseling. Some background. Tobacco use is the #1 cause of preventable disease and death in the United States. In Ohio and Cleveland especially, rates of tobacco use exceed the national average. As you can see by this graph, compared to the national average of 17.5%, the rate is higher in Ohio and more than double the national average in Cleveland. The good news is that most smokers want to quit. Almost 7 out of 10 smokers report wanting to quit. And more good news is that effective interventions exist and are covered by insurance under the Affordable Care Act. The problem is that despite having a health problem that's the greatest contributor to death, interventions that work and patients who want them, the rates of delivery of these interventions are low. As you can see by this graph, in Ohio, among Medicaid adults, only 5% receive medication to help them quit smoking, and only 2% receive counseling. The main reason for this discrepancy is providers cite time constraints, that they just don't have the time in their 15-minute visits to address tobacco use, on top of everything else that the healthcare system needs them to address, as well as on top of everything that patients are asking them to address. This brings us to this novel innovation, the AmeriCorps Super Coach program, which was created to solve the problem I've presented, lack of provider time to address tobacco use in the clinic visit. In our model, providers offer every smoker they see brief advice to quit, pharmacotherapy if they desire it, and a referral to a coach. Providers bill for the counseling that they do in the room with the patient, code 99406, and the coaches are embedded in clinic sites or available through Skype for direct patient coaching at the time of the patient's visit. The coaches also can provide phone follow-up. So far, our outcomes show that a provider with a coach accessible to their practice is 10 times more likely at UH to address tobacco use in their visit. Providers are billing up to $10,000 a year for the referral and the brief provider advice that they're giving to each patient. And the quit rate at 6 months is 30%. And this is compared to the evidence for motivational interviewing, which shows about 24% average quit rate for motivational interviewing. I'd like to cover some of the particulars, some best practices that I've discovered and have learned from others who have been referring patients to coaches over the past 2 years. And this is the sort of thing you could say to your patient when you see that they're a smoker. First, I'll say that I always address tobacco use after I address why they came in. Otherwise, they're not interested really in talking about anything else. So I'll say quitting smoking is the most important thing you can do for your health. And if you quit smoking, you can add up to 10 years to your life. I link tobacco use to their presenting complaint, and I acknowledge it's difficult to quit, but we're here to help and we have a great program. And I say, this program includes 2 elements. One is combination nicotine replacement, such as the patch and the gum, and this alone will triple your chances of success. The other great component of our intervention is that you'll be able to meet with a coach when we're done, if you choose to. They'll go over with you how to use the products that I can prescribe, and they can also help you be successful. Patients tell me they love working with a coach. The provider's endorsement of the coach has been an ingredient essential to the program's success. Then I'll say, would you like me to order these products, and do you have a few minutes to meet with a coach? I'm now going to turn to Courtney, who will describe what she does in the room. You can bring Courtney into your patient visit either by finding her in the clinic, or if she's not available at the moment, you can email supercoach@uhhospitals.org, including the patient name and MRN, and Courtney will follow up with the patient by phone. Here's Courtney.
Hi, so I want to give a brief description of what I do when I enter the room. The first thing I do is ask permission to talk about their tobacco use. It allows the patient to understand that they're in control of the conversation, and anything that they're comfortable with sharing, I'll be listening for. We then go through their day-to-day routine, about their tobacco use, if they wake up in the morning and smoke, and how many they're smoking and how often. After that, I ask them 2 scaled questions on a scale from 1 to 10, what's their importance of quitting, and then also on a scale from 1 to 10, what's their confidence in quitting. From that information, we usually come up with a plan on how to prepare them to quit smoking or how to decrease their tobacco use, and we come up with plans, alternative things they can do to distract themselves from that. I also describe their nicotine replacement treatment that's been prescribed to them, and finally we come up with a quit date. That quit date allows them to prepare and set an absolute date in which they're going to quit tobacco use. And the most important thing I do is the follow-up call. So post meeting them in the clinic, I'll give them a follow-up call whenever they want. They kind of have control of that, and it really allows them to have a support system inside and outside the hospital.
In this next short video, which is available on YouTube, I'll describe exactly how to document and bill for tobacco cessation counseling and treatment in your visit. And this is for university hospital providers who are using the Allscripts ambulatory EMR.
First thing you do is you go to social history, and you make sure that tobacco use has been assessed. If the person is a smoker, you click on the pad icon. And you then click on the care guide. Here you will provide the patient with educational materials, which counts towards meaningful use. This will get printed with their clinical summary. And you can also order your nicotine replacement products from this window. Then you click OK. Under orders, we'll go to procedures and click on the amount of time you spent and whether their presenting condition was related to their tobacco use. And then when you are submitting your charges for the visit, you go to MD charges, just like you would normally. For visit charges, in addition to their billing code for the visit, you're going to select this top tobacco cessation option. And this is code 99406. You're going to also select the modifier group 25, which is not available in this test record.
Next, I would like to describe just a hip pocket approach I have to prescribing combination NRT. For the patch, you basically determine, are they smoking more than 10 cigarettes a day or not. If they're smoking more than 10 cigarettes a day, I start them at 21 milligrams for 6 weeks, drop down to 14 milligrams for 2 weeks, and 7 milligrams for 2 weeks. If they smoke 10 or less, I start them at 14 milligrams for 6 weeks, and then 7 milligrams for 2 weeks. In addition to the patch, I prescribe either the gum or the lozenge. The lozenge being preferable for people who don't have teeth or have trouble with chewing. The dosing and the criteria for dosing are the same. So if they smoke within 30 minutes of waking up, I'll prescribe the 4 milligram gum or the lozenge. Otherwise, I'll prescribe the 2 milligram. And then I'll provide enough for them to use at least one piece every 1 to 2 hours for 6 weeks, and then gradually reduce use over an additional 6 weeks. In conclusion, I've described an intervention that has its success or failure based on providers' brief advice. For this to work, the program relies on providers making a strong endorsement to patients to quit, prescribing nicotine replacement therapy, and referring to a coach. Our quit rates for this program are highly successful, higher than what's shown in the literature. And documentation and billing for this initiative allow you to meet meaningful use requirements as well as increase revenue for your practice. If you are interested in having your patient meet with a coach, you can find Courtney in the clinic or email us at supercoach@uhhospitals.org to place a referral. And in summary, the AmeriCorps Coach Program, AmeriCorps Super Coach Program makes addressing tobacco use fit into your time-constrained outpatient visit. Thank you.